Hello, my name is Bateman, and this is my literature review over gestational diabetes. This topic is important to me because I work on the labor and delivery unit and I see several patients come in with gestational diabetes. This can lead to the newborn developing hypoglycemia or hyperglycemia. The mother is also at a higher risk for developing type 2 diabetes from having the gestational diabetes. This can affect any pregnant woman with a risk factor as well as her fetus and newborn. Risk factors include advanced maternal age, previous macrosomia, obesity, history of gestational diabetes, history of intrauterine fetal death, and recurrent miscarriages. This topic is important to the healthcare system because gestational diabetes can escalate healthcare costs and can lead to legal issues such as neonatal injury from a shoulder dystocia, neonatal death, macrosomia, which can also lead to shoulder dystocia, and neonatal hypo or hyperglycemia. This topic is important for patients because this disease can lead to type 2 diabetes, which can lead to other complications such as cardiovascular disease. Cardiovascular diseases can include anything from stroke to heart attack or anything like that. This is also important for the patients because it can get pretty expensive because the patient may need to purchase prescriptions such as insulin or oral diabetic controlling medication such as metformin. Patients are also required to purchase a blood glucose monitor with testing strips to monitor their blood glucose throughout their pregnancy. My PICO question is, for pregnant women, will early prevention and intervention prior to 28 weeks decrease the risk for developing gestational diabetes? Women are tested for gestational diabetes anywhere from 24 to 28 weeks according to the clinical guideline. Research was done using ScienceDirect, Medline with full text, and Directory of Open Access journals, and these were obtained from my university's library database search. Search terms included gestational diabetic and prevention, and early intervention and late detection, and late intervention and prenatal care, and was my Boolean operator, and this gave me 6,719 results. Results were narrowed and filtered by the article published within the last 5 years, peer-reviewed articles, and academic journals. These filters narrowed my search down to 69 results as opposed to the 6,719 results I started out as. I chose these filters to narrow down my research because peer-reviewed articles increase the validity of results. Articles published in the last 5 years increase the relevance since healthcare and evidence-based practice is constantly changing. Lastly, I chose academic journals because personally I find them easier to read and it's easy to download them as PDF files. The 5 main articles I chose were due to their relevance, significance, and information needed for this research. These research articles I found had several similarities. The purpose of these articles was to determine if early prevention and intervention techniques decrease the significance of gestational diabetes. All subjects in these tests were currently pregnant. Major findings for these articles included decreased development of gestational diabetes in mothers who participated in early prevention and intervention. Another similarity between these was they all had an informed consent signed for every study. Some inconsistencies included sample size, a difference between the inclusion and exclusion criteria for the articles, differing levels of evidence. I had, of the 5 main articles, one was a level 1 evidence, one was level 2, and 3 were level 3s. And differing methods were also used, such as differing designs, data collection procedures, and data analysis methods. Some limitations included that all of the studies were performed in just one hospital, so that really limits the participants. 2 of the studies were limited to only Chinese women. 1 study was limited to just Nigerian women. And 1 study had incomplete prenatal data, which they had to eliminate some participants for that. Some of the gaps included what are the most effective interventions for prevention? Is one better than another? Are different interventions necessary for different ethnicities? Does one work for Caucasians better than it does African Americans, and so on? Are there any undiscovered risk factors present that we don't know about yet? In conclusion, I feel like there is enough evidence here to support early prevention and intervention for all pregnant women to participate in. This will greatly decrease the prevalence of gestational diabetes all over the healthcare field. All of the research articles agreed and found that early prevention and intervention was effective in decreasing the incidence rate for the development of gestational diabetes. The current guideline for diabetes in pregnancy discusses the need for preventative measures, but it does not include what those preventative measures are or how they can be different for people with different ethnicities or different health problems. The guideline also talks about early testing needed for patients at a higher risk, but it does not state what those higher risk factors are. And in one of my articles, it states that high risk factors can include advanced maternal age, previous macrosomia, obesity, history of gestational diabetes, history of intrauterine fetal death, and recurrent miscarriages. I believe that these guidelines need to be edited to where it states those preventative measures and indicates what those high risk factors are for the need for early testing for these patients, so that the obstetricians can determine which patients need early testing and which need preventative measures and what those preventative measures are. And also for the nurses, so they can advocate for their patients and give them a better pregnancy outcome for them and their newborn. And then here are my references. And that's it. Thank you for listening to my literature review about gestational diabetes. Thank you.